use those COMAT exams at the end of each core clerkship. We administer them to 7 subjects during year 3 and 1 subject during year 4 at the end of their rotations. And we've established our own minimum standard of passing. We've set that at about the 4th national percentile as determined by the NBOME. And we use it as a barrier exam. Our students must perform at or above that minimum standard in order to pass the clerkship rotation. And if they don't perform at or above that standard, we give them an opportunity for remediation. We allow them to retake the exam. So we hold that exam in pretty high regard. We use it as a pretty strong standard of performance to determine whether our students are ready to move on, whether they've learned what we consider the amount of knowledge that they need in order to be considered competent in each of those various clerkship subjects. As soon as the NBOME was releasing this COMAT series, we jumped on board as quickly as we could. We weren't part of the beta test, but we knew about it, and we were looking forward to adopting these exams when they came out. So summer of 2011 was when we started them. We started them at the beginning of that clerkship year, July of 2011. We desperately needed an exam that contained those the osteopathic view of each of those subjects. We weren't doing our osteopathic students any favors by administering allopathic exams to them. It was almost as if we were granting that permission to turn a blind eye toward the osteopathic profession. So when COMAT came out, we were just thrilled and excited to jump over to those so that we could take advantage of the osteopathic content that those exams focused on. So if we felt like it was a more valid assessment of our DO students compared with their osteopathic student colleagues, we've done our own assessment of their performance on the COMAT exams as it compares to Comlex Level 2 CE. And individually, each COMAT subject has a correlation coefficient that ranges between 0.52 and 0.68. So those are pretty strong positive correlations with individual subjects. But what really convinced us that this exam was one of the best ways to prepare our students is if in our case, if we average their performance across all of the subject exams, come up with an average score for those 7 cores that were taken during the 3rd year, that correlation coefficient jumps up to 0.81, which is unheard of. Now, of course, it makes sense because it's essentially combining 7 high, excellent exams across the clinical subjects, which is essentially what a Comlex Level 2 CE is. So a high correlation like that, maybe it shouldn't be so surprising, but we advise our students that if you perform well on these COMAT exams, you're going to be just fine when you take your Comlex Level 2. If you struggle on any of these subjects, that's a key indicator that you need to put in some work. You need to prepare yourself, particularly on that subject, before you take your Comlex Level 2 CE exam. So we feel like these COMATs have been an excellent tool in helping them perform well on their licensing exams and eventually to perform well in the profession. We start every clinical orientation by telling students, you need to go to the NBOME site and look at the blueprints, look at the COMAT blueprint, because a lot of these students come, they have finished their Comlex exam, but they've never taken a COMAT exam other than just their exposure to the NBOME was that first licensing exam. So we just tell them, Look at those blueprints so it's not a surprise to you when you're taking the exam. And those blueprints are outstanding. They really are a thorough tool for the students to use to determine whether they're going to be prepared for that exam.